Hi, everyone. This is my presentation on my complex problem, the obesity epidemic as a global public health crisis. So, what is obesity? Obesity has been described as a worldwide pandemic. It is a significant global health crisis that is defined as having a body mass index or BMI of 30 or higher. Here you can see the BMI calculation, which is weight in kilograms over height in meters squared. BMI classifications for white, Hispanic, African American adults have been endorsed by the National Heart, Lung, and Blood Institute, the World Health Organization, or the WHO, the American Heart Association, American College of Cardiology, and the Obesity Society. Obesity is split up into classes of 1, 2, and 3, with class 3 being the most severe form of obesity. Obesity class 1 classifies as a BMI of 30 to 34.9 kilograms per meter squared. Obesity class 2 is classified as a BMI of 35 to 39.9 kilograms per meter squared. And obesity class 3, which is the most severe form of obesity, has a BMI of greater than 40 kilograms per meter squared, or around 35 kilograms per meter squared, or less than that in the presence of comorbidities. So this transitional classification underestimates risk in Asian and South Asian people, and there is generally an entirely separate guideline for this population that classifies overweight as a BMI of 23 to 24.9 kilograms per meter squared, and obesity as a BMI of greater than 25 kilograms per meter squared. So these body weight calculations also differ significantly between adults and children because of variations in growth and body surface area. And there's also a significant difference between males and females when it comes to obesity. So the prevalence of obesity in developing countries is increasing towards levels currently seen in the United States. Here is a video clip from the Center of Disease Control and Prevention, or the CDC, explaining the many factors that have contributed to this epidemic, specifically in Americans, and it also showcases several community initiatives taking place to prevent and reduce obesity.
At its simplest, obesity results from people consuming more calories than their bodies burn. But it's a more complex problem than that. People didn't decide to become overweight. Their weight gain is a consequence of complicated changes in the environment, where food is more readily available and opportunities for physical activity are lacking.
Societal, economic, and cultural conditions have all contributed to the rise in obesity.
One contributing factor is the fact that the way we eat has changed over the last 50 years. Americans are eating more processed foods and eating out a lot more frequently. The foods that are offered in restaurants, snack shops, and in vending machines are higher in sugar, calories, and fat than what we typically prepare in our own homes. We are surrounded by food. We are constantly bombarded by it. We're consuming larger portion sizes and more calories than ever before. Another factor is that people who live in poor and rural communities may have less access to quality grocery stores that sell healthy and affordable options. In these areas, it might be easier and cheaper for residents to purchase less healthy foods and beverages.
At its simplest.
So there are many different multifactorial causes of this obesity epidemic, one of those being dietary and lifestyle factors. So this means that there is increased consumption of processed foods, sugary drinks, and high-calorie diets, and decreased physical activity and sedentary lifestyles. Another one of those causes is socioeconomic factors. This is mostly having to do with limited access to healthy and affordable food options, and this occurs particularly in low-income communities. There's also environmental factors associated with this epidemic, and this is having to do with food marketing, especially targeted towards children, and the built environment that promotes unhealthy behaviors. And as you can see on this image on the right, it gives you some causes and effects of the obesity epidemic. So globally, the prevalence of overweight and obesity has increased by 28% in adults and 47% in children between the years 1980 and 2013. As you can see here, the worldwide obesity rate has nearly doubled since 1980, and current estimates from the World Health Organization suggest that in 2023, worldwide, there are more than 1 billion people who are obese, and of those people, there are 650 million adults, 340 million adolescents, and 39 million children. Obesity also currently affects 4 in 10 Americans, and a rough estimate is that 4 million people die each year as a result of obesity. So there are also different consequences of obesity. One of those being individual health, which can lead to increased risk of chronic diseases. This can be certain different types of cancers, cardiovascular disease, disabilities, diabetes mellitus, gallbladder disease, hypertension, osteoarthritis, sleep apnea, and stroke. There are also public health consequences of obesity, and one of those being strained healthcare systems. Obesity fuels higher demand for services, doctor's visits, hospitalizations, and specialized care. This overwhelms systems and leads to longer waits and limited access and decreased quality of care. There's also rising healthcare costs. Obesity drives up spending on medical treatments, medications, and surgeries for related conditions. And there's also reduced productivity, which means that obesity increases absenteeism due to illness and appointments, and this mainly impacts staffing and workplace output. It also contributes to early retirements due to disability or health concerns, drains valuable skills and experiences, and increases reliance on disability benefits. And on this image on the right, you can see some of the different types of cancers that are associated with obesity. So there are also possible solutions to this epidemic. Public education and awareness campaigns can be extremely important by promoting healthy eating and physical activity habits. There's the implementation of school-based nutrition and physical activity programs. So these schools can offer children further involvement in active extracurricular activities such as sports, etc. There's regulation of food marketing practices targeting children. And also, in my opinion, one of the most important is catching it in its early stages. By doing this, it can be easier to manage. It can reduce health risks by preventing or delaying chronic conditions, can help restore metabolic balance and prevent diabetes and other metabolic syndromes. And it also can have psychological benefits by preventing low self-esteem, depression, and body image issues. And there's also long-term health benefits, which would lead to a healthier, more fulfilling life with reduced healthcare costs. So, a call to action. Overweight and obesity have reached nationwide epidemic proportions. Both the prevention and treatment of overweight and obesity and their associated health problems are important public health goals. This is a quote from the National Library of Medicine, and we need to take action now to address this issue. And here are some ways that we can do that. So, as an individual, you can make healthy lifestyle choices, such as eating a balanced diet and exercising regularly. Governments can implement policies that promote healthy eating and physical activity. They can make healthy foods options more accessible and affordable. And they also can invest in research and development of obesity prevention and treatment programs. Businesses can also contribute to this by creating workplaces that support healthy eating and physical activity. They can offer health and wellness programs to their employees, and they could also partner with community organizations to promote healthy lifestyles. Healthcare professionals are also important in this role because they could take the time to screen for obesity and other related health conditions during routine checkups, provide counseling and support to patients on healthy weight management, and advocate for policies that promote obesity prevention and treatment. Thank you so much for listening to my presentation, and here is my works cited.